Welcome back to the Elias Macko Show. Yesterday afternoon, we had to take our son to our family doctor. He still hasn't bounced back 100%. Of course, we're nervous parents of a not even 2-year-old, so we just wanted to make sure everything's okay. And I'm at the family doctor, and I asked the family doctor about everything going on in healthcare and Bill 2. And I said, so what's going to change here with Bill 2? And deadpan, she tells me the government wants to pay me $14 for this visit. And of course, my jaw dropped. I don't know how you pay the bills with $14 for a visit. And that's led us to our guest today, Dr. Laura Sang. She recently penned a piece in the Montreal Gazette about how she is paid. And with that in mind, we've got a story in La Presse this morning about doctors in the Laurentians and the Lanaudière, and how many of them are considering leaving Quebec. So let's go to Dr. Laura Sang now, a family doctor in the Lower Laurentians, with more on this. Dr. Sang, welcome back to the show.
Hi, thanks again for having me.
So, you just heard me say $14 is what my doctor said is what the government wants to pay there. Is it that bad? Is it, when you look at Bill 2, is it going to get that bad when it comes to your pay?
So it's projected to, for doctors in general to lose about 30 to 50% of our pay. Based on some of the figures that have come out and a calculator that was provided to physicians to help us calculate a new projected estimate of our income.
What do we not know? What do most people not know about the way doctors, family doctors, are paid in the province?
So family doctors are considered, autonomous workers. We're self-employed. Even though we're paid by RAMQs, we're not employees of the CIUS or of the region. So any day that we do not work, we are not paid, and we're pretty much only paid when we have patient contact. We have no paid vacation days, no paid sick days. We're not eligible to receive a pension. We cannot claim CNSST if we are injured. So all of these things have to be budgeted for by physicians themselves. And in terms of working in clinic environments, like any other professional, that works in a private clinic, we in JMS and partially government-funded clinics actually have to pay rent and overhead costs to be able to work there, which usually comes to about 30% of our gross income that goes towards that.
Gotcha. Now, I look at average salaries, right? I see average salaries of doctors in Quebec, and you see it's in the hundreds of thousands of dollars. But in that, right, you've got to pay all of that over the overhead, planning for your pension. So is that what's lost on a lot of people? Like, we may see the high yearly salaries, but you've got to manage everything that maybe some people would not be aware of.
Yeah, exactly. So, there's no denying that we're well paid. That's not the topic of discussion here. It's that we need to be paid a sufficient amount to cover the overhead costs for those of us, especially working in clinic, all the costs that come with that. I know for me, without even seeing a patient in my office, just paying my overhead, all my licensing fees, the mandatory continued education, probably my overhead starts at $60,000 a year.
Are you part of that group that would have to close up clinic if this law, does go fully into effect?
I'm hoping not, but there's no denying that, my clinic and many other clinics are very much at risk, especially because most of the doctors where I work are nearing retirement age, so there isn't anyone to replace them. And you need to have a certain, number of physicians present to cover the overhead costs, to make sure that, patients are taken care of, and without, the necessary personnel present, it just becomes financially unfeasible for a clinic to remain open.
So, I'm looking at another story. We had Aaron Durfel from the Montreal Gazette on our show yesterday, and he's recently taken a look at two claims from the Quebec government. One, that Quebec has more doctors per capita than Ontario, and that there's the access to family doctors isn't as good in Quebec as it is in Ontario. Okay. And he looked at those claims by the government, and he says, well, at least those two claims is correct. The government is right in saying that Quebec has more doctors per capita than Ontario, and that we have less access to family doctors in this province. Why do you think that is? Why do you think that there is that disparity here? We've got more doctors, less access.
So I think it's not a less access; it's a different kind of access. And I think a lot of it has to do with that Prem AMP system, because unlike in Ontario, in Quebec, family doctors do so much more outside of office-based practice, especially with the mixed AMP system, which is where, we're held to these mandatory activities mandated by the government. Many family physicians have to work in more than one location. So it's impossible for us to be in the office seeing patients on an outpatient basis 5 days a week. I know personally I work in an inpatient rehab center helping patients who recover from stroke, from car accidents. So part of my time is spent there. And a lot of family doctors, work in obstetrics, in our CHSLDs, in hospitalist work, home care. So, of course, if family doctors are divided doing so many of these activities, more so than in other provinces, of course, we're not going to be in the office 5 days a week and having the same kind of access as if we were exclusively doing an office-based practice.
And as you write in the Gazette in your piece, and as you've mentioned in this interview, right, you've got a simulator. It sort of allows you to try and figure out how much you'll make under the new regime. But when do you think we'll start to see? Because obviously we've heard threats, and we've heard people say, well, I'll leave to another province, or I'm going to close up the clinic. When do you think we will actually see the effects of Bill 2 start to take effect? When will we see, clinics closing and that kind of stuff? When will the straw break the camel's back?
I think we're already, seeing evidence of clinics closing. We've already seen, the last I checked, it was about 400 doctors from Quebec that had applied for licensing in other provinces. People are already looking to leave. People I know who are, maybe a few years from retirement are announcing their retirement early. So the access is already decreasing. People are already announcing that they're leaving. I'm wondering if we're really going to start to see changes as of January 1st, because that's when the new
rates, there's new rates of
come
compensation
into effect. Mm-hmm. And I know, another thing that's maybe not known is that most physicians, we have to work with a billing agency that we also have to pay for that, helps manage our billing since it's by act. And we've received a lot of emails that, they're not entirely sure how this is going to work. So everyone's going to be having to learn how to manage this. Mm-hmm. And I think that once the financial impacts start to hit and people start to see what has happened to their income, that's when we'll have a better idea of what's viable, what's not. But the projections are not very optimistic as it stands.
I had a doctor this week tell me that they feel that the government's calling them lazy. Do you feel that way?
I don't know if I feel like they're calling us lazy, but I do feel scapegoated and villainized. This is a very systemic issue stemming from decades of decisions and, loss of a variety of healthcare personnel. And I think that it's unjust and unrepresentative to put the onus of all of this on physicians and exclusively physicians without addressing the root cause and without providing resources to physicians to better tackle the situation.
Dr. Sang, we have to leave it there. I want to thank you so much for coming on.
Thank you again for having me.
That's Dr. Laura Sang, a family doctor in the Lower Laurentians.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.